Welcome today, Mr. Dr. Ovid Stephen Barrow, to Hills Academy. Uh, we thank that you came to speak with us and tell us about what you do and how you got to this point. So first I want to start off is what made you go into internal medicine?
Well, thanks for having me here, first of all. I really enjoy talking to young folks and trying to inspire uh, other folks to get on the path of doing something better and more productive. My journey to internal medicine is a very long one, and I wouldn't bore you with it. It's had lots of trials and tribulations there. So I went to medical school at the age of 35, and at 40 I was an intern because the first year I failed. But the setback for me was for me to make a big comeback. So I did not let that bump in the road throw me off the track. So I graduated from medical school at the age of 40. And after that, you have to do 3 years. Now, I had a choice. I went to Downstate Medical Center. And so I had a choice of doing other types of medicine, subspecialty. But I think I would derive the greatest benefit and be most productive in my community as an internist. And so I ventured into internal medicine. I haven't looked back, and I'm happy I chose that.
What would you say in your childhood tried to keep you from getting to what you wanted, but you went past it?
Alrighty, that's an excellent question. Uh, I was never able to learn. I wanted to learn. And I would go to school, I had a question to ask, and I would be focused and locked in on that question. And before I knew it, the bell would ring, signaling the end of the class. At that time, I didn't know what it was. And only until I became an adult and in my 40s, I realized I had ADHD. I've never been diagnosed. I'm fortunate to live with my wife, who is a child psychologist, and she was able to point it out, and it made sense. It made sense that a lot of things that I did, a lot of problems I got into, and how I was able to study. So I think that's what kept me away from excelling at an early age. I'm a late bloomer. And because of my ADHD, which I still do have, not diagnosed, again, in a formal way, but via my wife and for me reading and being in the field of medicine, I'm able to cope.
Do you mind telling us about where you grew up and how it was like?
Okay, so I grew up in South America, Guyana, and I came to this country in my late teens. But in Guyana, I grew up in some rough places. I grew up in a place called Lodge, and then I moved to another place called All Boys Town, which is very tough neighborhood. And the young guys there, they fought a lot. And from there, I moved to another area called Charlestown. Um, my schooling at the age of 10 is the earliest you can actually go to high school and or take an exam, not the earliest you can go to high school, take a specialized exam to go to high school. And these high schools sometimes are specialized and sometimes they're not. And so I took the exam at 10 and I passed it. I'll be honest with you, how I passed it, I have no clue. But I went to high school. You go to high school for 5 years. There's no middle school. And so at the age of 15, 16, you can be out of school. And so I started working at the age of 16. Real jobs to put food on the table, not just to buy sneakers or t-shirts or anything like that, but to contribute towards the family. I came here at the age of 19. I just turned 19 when I came to these States. And I had an option of either trying to go to school or go to high school or do something else. And I went into the military. So I went into the military and I spent 3 years active duty, and then I went for another 13 years as a reservist. I went into the Navy.
Is there anything you would say that you've done now that you wouldn't have done in the past?
Something that I would have done now that I would not have done in the past. I have not regretted anything that happened now and in the past, because I sort of accepted my you might call it faith, but I accept my design because of where I came from and the things that I did as a youngster in New York, in Brooklyn, coming as a teenager and getting exposed to a certain lifestyle. I was constantly challenged to go down the wrong path, but I had a lot of belief in myself and I never went down that path. So, but it was not easy. I have no regrets. My life is what I accept it to be. I just want to continue to thrive, to be a positive person for myself, my family, and then for my community.
Is there anything that you would want young men like me and any other person that is struggling to encourage yourself? Do you have anything that you would say to encourage them?
Yeah, I want to, I do talks and I like to talk to young folks. And I try to tell them about birth and creation, and that you are special, you're chosen. Any other way of the way you're created, you would not have existed. So you're here for a reason. There's a purpose. Try to find your purpose. What is my goal? What's my purpose? Why do I exist? I think you need to start doing introspection. Start thinking about things that you do, where you are. How can I start projecting? Where will I be in 5 years? Where will I be in 10 years? Will I have a family? Start thinking about these things. What I've done different models and challenging myself and asking myself questions. I have moved all the way to my final stage in life, which is death. And for me, I said, how do I want to be remembered? Therefore, if I want to be remembered this way, then I need to do these things in order for me to get here. So I tell young men, have a vision, have a positive vision. There are going to be challenges. You don't quit on the first challenge or bump that you encounter. Find another way how you do it, how you're going to get it done. Many of our scientists, they have tried the first time and they did not succeed. They have now learned how not to fail that route. So you can use another route. Persistence, perseverance, humility, and a willingness to learn is going to take you a long way. I reared 2 sons. Well, I call one of my cousins my son. But my oldest son is 38. He made it all the way to the league. And again, because I told him education is more important than anything else you can get. The league is a vicious sport. So when he got let go, he was still able to continue to work as an engineer, electrical engineer. So it's very, very important that we have that mentorship, whether it's coming from a parent in the house. And I never grew up with a father. My father, I've seen my father maybe 10 times in my whole life. He's now expired. He died at the age of 86. But I didn't have the love. I've never hugged a man where, hey, you know what? This is love coming from a heart. I've never been through that. It was always my mom, and I grew up in rough places. From moving from Guyana, from Charleston, I moved to East New York and Brooklyn. That was not a piece of cake at all. So you had to learn challenge. You had to know when to, turn around and move back, step back. You had to know when to step up to defend yourself, because it's not always when you tuck your tail between your legs, folks will leave you alone. So it was all of that, facing all of that, and still wanting to do better is what drove me to where I am.
Can you tell me about your years in college and your ups and downs?
Okay. Love talking about this because didn't want to go to school. I didn't think I was smart enough after I told you the ADHD that was raging in me. So I went into the military. The first time I excelled in my life was when I went into military, and I was in the Navy in 1985, and I did well. In the class of 27, I think I was number 7. I was scared to go further because at that time I went as a hospital corpsman, and I remember the chief saying, hey, Barrow, we can get you set up to go to specialized hospital medicine school, hospital corps school. And I was petrified. I didn't want to because I thought it was a fluke. I just thought that I guessed the right answers. I really didn't know. I had no confidence in myself. When I got out of the Navy in 1988, I just hang around the streets, just couldn't get right jobs, getting menial jobs. I started working as a nursing assistant at Methodist Hospital in Brooklyn. But I couldn't keep jobs for too long. 6 months would be a long time because I had a terrible temper. I just couldn't. If you talked to me a certain way, I didn't like it, I would leave. I had much insecurities about myself. So I walked into college in Medgavr's College in 1989, not to go to school. I walked in there just to say school was nonsense, basically. And I remember walking into the school and sitting in this professor's chair, and she started telling me about college and some of the things that I can do. And I was like, I don't have my GED. She says, don't worry about it. We're going to bring you up from the bottom, the radix. I remember her saying the roots. And I wanted to get up, and I actually got up. And she said, young man, sit. At this time, I'm in my mid-20s, and I didn't feel that you had a right to talk to me that way because I always had a chip on my shoulder. But I sat. And then she says, you're going to take a test. It's called an entrance exam, and it's a basic math test. And I got up again, and she said, I'm not playing with you. You sit right there. Now, I'm married with children, and you're talking to me like this. And that didn't bode well with me at all. But again, I sat. And she did give me a test. It was 100 questions, simple questions. And I got 3 out of 100 correct. 3. And I remember her saying, don't worry about this. We're going to start you off from the basic class, and we're going to go from there. So I started college. I remember I went home and I told my wife and my mom I was in college, and it was a laugh. It was a joke because no one expected me even to go to a place called college. So I started, and after 1 year, I had 2 credits. And I had to do basic math and basic English, and I started from the bottom up. When I graduated from Medgavr's College, I had the highest GPA through Calculus 2. So my problem was probably not learning, but because I had the problem ADHD, where I was very hyperactive, I couldn't stay one place at one time, my mind was racing, it was inhibiting me from doing that. But I had good coping skills. That's what was told to me by my wife. So I developed coping skills to be able to sit and stay focused.
Can you tell me about your workplace and how the environment is?
Okay. Well, I am the site director of Emory Hillandale Hospital. I'm also the chief of Hospitalist Medicine. And in my work environment, we've actually removed an internal medicine doctor that would normally work in clinics, and we bring them into the hospital. So our skill set is a little more, calls a little more emergency care at the same time. We're on the spot. Somebody's breathing gets worse while they're in the hospital. We jump on that and we take care. We have things we call differential. It could be this, it could be that, it could be the third. And then we see which one fits with the other information we'll gather from the patient, knowing the patient, reviewing labs, reviewing their radiological studies, EKGs, EEGs. We'll review these things, and then we'll make a decision as to what is going on with that patient. Sometimes our decisions can be life-saving. Sometimes our decisions are over a treatment plan for over a course of time. But we constantly engage. We see patients with all kinds of medical conditions. If we are not able to treat them or don't have the specialty to treat them, we'll ask for something called a consult, where we'll bring a specialist in. So for example, if a patient has a big stroke where they're not able to move parts of their body and they can't speak, we will consult a neurologist who can get involved. They can come in, they will give us certain information as to how to treat the patient, we'll do that. But there are other things about that patient that we still have to take care of. So we will treat them, we will have consults when they're being discharged. We're the ones who do the final discharge on them. We are like the gatekeepers. When they leave the hospital, we write orders, we write follow-up, and we make recommendations for them.
those are all the questions I could ask you today or think about. Is there anything you want to say to any other young men that are trying to succeed in life?
Yeah, I would say stick the course. Do not let somebody shake you off from what you want to do. There are going to be many folks out there. There's going to be lots of distractions. You have to stay the course. Regardless of what somebody else out there thinks about you, if you know yourself, you're confident, and you're comfortable with who you are, do not let peer pressure move you from off your course.
Thank you, Dr. Barrow.
Thank you very much for having me. It's a pleasure, and anytime you need me to come back and talk, I will do so.